Hey everyone, and welcome back to the channel. Today we're going to be continuing with our review of the CPC materials. We're going to be going through ICD-10-CM chapters 12 through 22. So this is going to coordinate more so with the AAPC curriculum. The step-by-step curriculum actually breaks ICD-10-CM down into 3 chapters versus 2, which is in the AAPC curriculum. But whatever curriculum you're using, this is beneficial information for you. And of course, I have to give another reminder that this is review material. It is not intended to cover the entire curriculum. It's not intended to teach you all of medical coding. But if you're someone who is refreshing for a certification exam, or you are someone who is trying to refresh on medical coding after being out from it for a while, this is a great resource for you. Starting with ICD-10-CM Chapter 12. Chapter 12 is Diseases of the Skin and the Subcutaneous Tissue, codes L00 through L99. So Chapter 12 really focuses on conditions that are related to the skin, subcutaneous tissues, dermal steps. So a lot of the key diagnoses we see here are things like cellulitis, dermatitis, pressure ulcers. And those are some of the key things to understand, some of our key concepts, not saying that there can't be other concepts that may appear on a certification exam, but these are the 3 key ones. Like if I had to say, okay, let's pick 3 out of this chapter and let's figure out which are the top 3 we should figure out. These would be them. So for cellulitis, we want to make sure that we have the documentation for the laterality and the location, and that will allow us to select the most specific code. So like L03.115 is cellulitis of the right lower limb. You're going to see that a lot in some of these skin things because a lot of portions where we have skin are like limbs and so forth. So we're going to see a lot of right, left, and staging and severity. Dermatitis, though, is a little bit different. We differentiate that by the type and the causative agent. So like L24.2 is for irritant contact dermatitis due to solvents. Keep in mind, too, that we might want to have an external cause code. So something like if there was a certain substance that it was poisoned or they had an adverse effect to, we should look out for those as well. Pressure ulcers, those are a common topic in the CPC exam. And remember, we need to have a couple of different factors in here to make sure that we have the exact right code. The site, the laterality, and the stage. We use stages 1 through 4, and then we also have unstageable. Unstageable is when we can't determine the stage. So there's either like so much flaw or eschar or some kind of tissue that's covering that wound or that ulcer really, that we can't determine the stage. That's different than unspecified when they just don't tell you what the stage is. Also keep in mind that there is general ICD-10-CM guidance surrounding pressure ulcers that someone like a wound care nurse could document the stage. But if there is conflicting information, if the wound care nurse says it's a stage 3 and the doctor says it's a stage 2, then we have to submit a query for that. Chapter 13 covers diseases of the musculoskeletal system and connective tissue. So osteoarthritis, fractures, rheumatoid arthritis, those are some common ones to understand. For osteoarthritis, we code based off of the site, based off of the laterality. So M16.11 is for unilateral primary osteoarthritis of the right hip. Pathological fractures require the documentation of the underlying cause, such as osteoporosis as well as the laterality. And then rheumatoid arthritis codes depend on whether the rheumatoid factor is present and any complications like deformities that may be associated. Chapter 14 is a big focus of our diseases of the genitourinary system, or codes N00 through N99. Common ones that we are going to see here are things like chronic kidney disease. That's a big focus. CKD is coded based off of the stage, ranging from stage 1 to our end-stage renal disease. But then we also have things like urinary tract infections. So for UTIs, be sure to specify the site when documented. Otherwise, we do have an unspecified code, M39.0. Remember that there is some verbiage in regards to how we code for urosepsis. So urosepsis doesn't code to a UTI or to sepsis. Urosepsis has no mapping. So if a provider documents urosepsis, that has to be a query as far as what they meant. Benign prostatic hyperplasia is coded with details about the symptoms. N40.0 is for BPH without lower urinary tract symptoms, and then N40.1 is for with urinary tract symptoms. And then we also have here endometriosis, and that's coded by the location. So, for example, N80.1 is for endometriosis of the ovaries. Chapter 15 is an important chapter. It covers pregnancy, childbirth, and the puerperium. And if you know one thing about Chapter 15, it's that it takes sequencing priority over all other codes. So Chapter 15, our pregnancy codes, take sequencing priority over all others. So pregnancy, childbirth-related conditions, gestational diabetes is our 024 series, and those vary based off the management. So is it diet, insulin, oral medication control? Pre-existing hypertension is coded differently than gestational hypertension. So pay close attention to the documentation if that pregnant patient developed hypertension during pregnancy or they already had hypertension and then became pregnant. That does impact the code selection. Also, don't forget to use the Z3A category codes to document the weeks of gestation, and that is really essential for proper coding. Chapter 16 focuses on the perinatal conditions, so those that are present from birth through 28 days of life. This includes things like birth trauma, like prematurity, things like congenital infections. We always use Z3A codes, that category, to identify live births, specifying the place and the type of delivery. For prematurity, both birth weight and the gestational age are absolutely crucial for coding accurately, but also ensure that the physician documents it as prematurity. Conditions like congenital viral disease, such as P35.1 for congenital rubella, are also important to understand. Next, moving on from conditions from the mother to conditions to the baby is our Chapter 17 code, our congenital malformations, deformations, chromosomal abnormalities, and codes Q00 through Q99. So spina bifida, palate, Down syndrome, those can be coded as either first listed or secondary diagnosis. It's important to add codes for any associated conditions when they're present. For example, if a patient has hydrocephalus, it often accompanies a spina bifida. And if a congenital anomaly has been corrected, you should use the personal history code, the Z87 series, to reflect that. And remember that these codes can be used throughout the life of the patient unless that condition has been corrected. And that's when it becomes a history of code. Chapter 18 is for codes for symptoms, signs, abnormal clinical or lab findings. So we oftentimes will use these codes when we don't have a definitive diagnosis. However, if we do have a confirmed diagnosis, such as chest pain was due to angina, then we code only for the condition, not the symptom. So one of the signs and symptoms of angina is chest pain, so we would code just for the angina. Some of the commonly used codes in this area are R05 for cough, R07 for chest pain. Also, but again, when signs and symptoms are associated with an already diagnosed condition, they are considered integral to that condition, and we are not going to code them separately. If a patient comes in, for example, with a cough and we wind up determining that they have an upper respiratory infection, we're just coding for the upper respiratory infection. We're not including the cough because that's integral to having upper respiratory infection. Chapter 19 focuses on injuries, poisonings, and complications of care. So things like our traumatic injuries, fractures, lacerations are often coded by the type, the location, and the laterality. So like S72.001A is for a closed fracture of the neck of the femur on the right side. So these get very, very specific. When coding for burns, we have to make sure that we look at the site, the degree of the burn, and the extent of the burn. For poisoning, it depends on the intent. So was it accidental? Was it intentional? Was it self-harm? Was it adverse effects? And then for coding injuries, a lot of them use that seventh character extension, and that is essential. So oftentimes it's A for initial, D for subsequent, S for sequela. And those seventh character extensions have to go in the seventh character spot. So if we have a code that's only 4 digits, but we need to have a seventh character extender, we use that placeholder X. So if the code is A123, we would have to use X, and then we can use our seventh character extension A or S or D or whatever it is. Chapter 20 includes codes for external causes of morbidity. So that's kind of the how and the why behind these injuries. So for example, B03.00A is used for a pedestrian that's injured in a non-traffic accident. So these codes provide a lot of information about the type of event, whether it was accidental, whether it was intentional, like kind of the circumstances, the activity, the place it occurred. And keep in mind that these are supplementary, so they should not be a first listed or a principal diagnosis, but they are pertinent, especially in things like motor vehicle accident claims, where the insurance is trying to determine, oh, this patient had, a crushed wrist. Was this related to the motor vehicle accident or was this not? So like who's responsible for paying? And oftentimes they really want those external cause codes in those sort of situations where patients are presenting, for example, to the emergency department and we're trying to determine, is this a work-related case or is this a case where a patient was just out snowboarding or something and that's why they fractured their leg? We should include that place of occurrence when we have the access to that. So like Y92.48 is for a parking lot and Y93.01 is for walking because that does help complete kind of the picture. Now, Chapter 21 is all about the Z codes, and those are used to document factors influencing health status and contact and with healthcare services. So these are things like your screening services, preventative, family history codes, you've had an organ transplant. So things that might not necessarily be you have a diagnosis, but like we want to track this or provide a reason for these healthcare services. So Z12.11, for example, is for a screening colonoscopy. We also have status codes like Z94 for an organ transplant status, and that indicates that that patient has some ongoing conditions or statuses. We have personal history codes, family history codes. We even have like Z86.14 for a personal history of MRSA. So conditions that the patient had, but they're no longer present, but we need to keep track of them for clinical purposes. Z codes some of them can be listed primary, some of them have to be secondary. It really depends on the encounter type. And then lastly, we have Chapter 22. There's not a lot of codes in Chapter 22, just a handful. And those are codes for special purposes. People tend to miss these because they don't come in alphabetical order. They do come in chapter order, but not alphabetical order. So people will look for those U codes and they want to look them to be after the T codes, but they're not. They're at the very end in Chapter 22. So, for example, our COVID-19 code is U07.1, and that was introduced as an emergency measure to identify and track that virus that emerged during the pandemic. And these codes also cover new emerging conditions that don't yet have a permanent classification in ICD-10-CM. Commonly, you don't see them on the CPC exam, but you might. So it's important to understand them, and especially the context of how they impact public health and new health threats. Codes in the U50 through U85 range are primarily for research and specialized purposes. So again, they probably won't be used frequently on the CPC exam. Now, next, I want to start going over some practice questions with you guys. So our first question that we're going to have here is a 45-year-old patient presents with chronic right knee pain. They're diagnosed with primary osteoarthritis of the right knee. What is the correct code? So we have M19.011, M17.11, M19.11, and M17.9. So what are we going to code here? Are we going to code for knee pain, or are we going to code for the osteoarthritis? So knee pain is really a symptom of osteoarthritis, so we're going to code for the definitive diagnosis, osteoarthritis. So we're going to go into our book and we're going to look for osteoarthritis. Be careful because there are words that are spelled similarly that can trip you up. So here we have osteoarthrosis, and I could easily pick the wrong code by doing that, but we're looking over here a little bit more osteoarthritis, and I'm going to zoom you guys in so we can see what we're doing here. So we're looking at osteoarthritis, and here is our knee. This one is not bilateral, it is unilateral, and it's the right knee, and it says it's unilateral primary of the right. So unilateral primary. We have to go get some additional characters here because here's our check mark, and that means we need additional characters. So we're going to go over to M17 and then M17.1, unilateral primary osteoarthritis of the knee, and we're looking for the right knee. I'm going to come out a little bit here. Unilateral primary osteoarthritis of the right knee, M17.11. It doesn't say we need any additional characters, so let's go back over to our quiz question here, and that means M17.11 is our answer B. So that would be our correct code for primary osteoarthritis of the right knee. Moving on to our next question, a patient with chronic kidney disease at stage 4 for follow-up, what code should be assigned? So we need to look for our key term. What's the key term here? Is it going to be chronic? Is it going to be kidney? Or is it going to be disease? If we were to look up kidney, it would probably tell us to see condition. So what's the condition of the kidney? It's diseased. So that's the term we want to go to. We want to go to our D for disease. So we're going to head over to our book and we're going to pick out our D for disease and then go to kidney. So here is kidney disease. And if we look here, we can see kidney disease, chronic, but this is just the unspecified code. We have a stage here. It's telling us that it's stage 4. So here's our stage 3A, 3B, stage 4 severe, N18.4. We don't want to code those directly from the alphabetic index. We want to verify in the tabular list N18.4. Now, for purposes of the certification exams, it's up to you. If you want to save that time, you could also, what I sometimes recommend doing is if we're looking at a question like this, where we're saying, okay, all of these codes are either N18 point something, we could just go to the N18 section and look them up there. That is an option. Because if we go to the N18, there's N30. If we go to the N18 section, we can see here chronic kidney disease stage 3A, 3B, and then there is our N18.4, which means that our answer here is going to be our N18.4. And again, if you want to save time and just go straight to those answers because you know they're like very close proximity to each other in the book, that is absolutely an option that you can use as part of your test strategy. It determines on how much risk you're willing to take versus how much time you are taking. That is a personal determination. There is no right or wrong way to really do that for the exam. Moving on to our next question, a patient is diagnosed with stage 3 pressure ulcer on the left heel and a stage 2 pressure ulcer on the left hip. What codes are appropriate? Now, if we know a little bit about our pressure ulcer codes, we know we definitely need 2 codes because pressure ulcers can't be combined, especially if we're talking about 2 different locations and 2 different stages as well. What we could do, again, is just go to our L89.6 series codes and determine that, and our L89.2 codes and determine which one of these is correct. I'm guessing one of these is probably heel, and then one of these is probably hip. So we could look those up. I'm actually going to go to our L89s because both of them are from the L89 series, so that might save us some time. So the first code we have is this L89.6, and it's going to be 6 something. and it's a stage 3 pressure ulcer of the left heel. So we have pressure ulcer unspecified heel. It's not an unspecified. We're looking for a left heel. So left stage 3, if we just kind of look around a little bit, we can see L89523. That's ankle. L89623, pressure ulcer of the left heel. Here we go. L89623, pressure ulcer of left heel, stage 3. And we can see that that is our option A. So already, if we're like, yeah, I'm absolutely positive that's the right option, we can go back to our test question here. And we can already determine that it's L89.623. If we want to verify and say, oh my gosh, like let me go back here and double check that the second one is the correct one, L89.22. If we flip back L8922, 222, right there, pressure ulcer of the left hip, stage 2, and that's what the question was asking for, so it's definitely going to be our option A. Our next question, we're looking at a patient is in the 3rd trimester of pregnancy and has been diagnosed with pre-existing hypertension. What's the appropriate ICD-10-CM code for pre-existing hypertension? So we have a few different variations here. We have some 010 codes, we have some 016, and we have our good old I-10 for hypertension. So, what are we going to do for lookup for this? We're kind of all over the place as far as code selection, and what are we kind of looking at? Like, what terms should we look up for this? So if we go to our codes for hypertension, we do have a lot more codes than just I-10 for hypertension. We have here hypertension, and then down here is pre-existing in pregnancy, pre-existing, and then it doesn't say it was secondary, so it's going to be essential or primary hypertension, 010.01, and then we need an additional character there. And it said that it was the 3rd trimester of pregnancy. So pre-existing essential hypertension, complicating pregnancy. Do we have a 3rd? 3, pre-existing hypertension, complicating pregnancy. And there it is, 3rd trimester. So in this case, our correct answer is going to be our option B, 010.013. One last question. A newborn is diagnosed with neonatal jaundice due to prematurity. What code should be used? These are kind of separated apart. We have a few that are in the P59 category that we could just go and look there and see if anything there looks right. But then we also have this P07.3. But let's take a chance. Let's say we're going to go and look at our P59 codes. If 3 of them have P59, I'm feeling kind of a way about having P59 there. So we're looking at a code for neonatal jaundice due to prematurity. And we have all these P59 codes. What have we got here in P59? Is there anything under P59 that looks like neonatal jaundice due to prematurity? We have a P59, 0, 9, and 8 are our options. So this one is associated with preterm delivery. That sounds, prematurity. Let's check the other ones, though. This one is neonatal jaundice from breast milk. No, that's not the neonatal jaundice unspecified. No. And if we were to look up P07.3, it would actually tell us that P07.3 is for extreme immaturity. So in the case of this scenario that we're looking at, it really more so is our option A, the P59.0, the neonatal jaundice due to prematurity. So that's it for this section. That covers the entirety of the chapters in ICD-10-CM. All right, I hope you did find this video helpful. If you have any questions, definitely leave them for me in the comments below. Don't forget to share with your friends, your fellow students, or if you're an instructor, share this with your students. I hope to see you guys in the next video. And until then, just keep on coding on.